None of that.
Morning,
None of
Doc.
that this morning.
Morning. Well, Doug didn't really educate either, so I wasn't sure whether this would go through because I didn't want to pry into people.
Yeah, man. Well,
At
you
the
know,
end of the day, it's a very personal thing.
Yes, yes, yes.
Doug
um,
already asked Joy. You understand? He already got confirmation and was
Permission
accepted.
from Joy.
All
Joy.
right, let me give the listening audience a little
Mm.
heads up. This is the part of the program that we aspiring to call "What's Up, Doc," wherein that persons with ailments would have the ability to call in with their symptoms and be diagnosed on radio by our distinguished panelist, Dr.Alwayn Leacock. We've had quite a few practical cases where that is concerned, and one of the most touching ones is what we're about to discuss this morning. One of our panelists, actually, one of the original panelists, was part of the 3D and would have been with me overnight and all kind, Mr. Douglas Howard. Um, Recently had an operation, a procedure based on, something that is prevalent in the African American male community, where prostate cancer, is a killer. As a matter of fact, prostate cancer would have taken Randy D, who would have sat in this chair before I started. At this time, before I started, some 13 years ago, and it's something that is, because even, there are the several radio personalities that would have left us, on the same thing, and it's something that is prominent, that is very popular amongst African American, and me being at 62 years old is something of grave interest, and we think Doug's willingness to talk about this, because this is not something that most men like to talk about. We think Doug's willingness to talk about this issue is something that is ah, very helpful, and hopefully persons listening who would be encountering similar symptoms could listen and learn from his experience, and of course the advice of Dr. Leacock. Yes, there we go. Gentlemen, go ahead.
Well, I'm not sure if I'm giving any advice. Good morning to the listening people. Um, I'm not sure if I'm giving any advice, but it's just a deep sense of awareness. But before I go on to Doug Howard, just quickly let me just state something that's on my mind. So school has come back, and a lot of young women have been graduating from primary school to secondary school. And I don't know if their parents, whether it is mother, fathers, had any word to sit down to talk to them about the birds and the bees. And in particular, I was thinking this week about young women and having problems with their periods. So for some women, their first period probably come while they're in secondary school. Some may come late in primary school, actually. And I was just wondering whether or not that is a conversation their parents would have had with them, what to expect. Because you may go to bed as a young woman in the morning, wake up in the night, and your bed's flooded with blood, and you think you're going to die because nobody's spoken to you to say that you're at that reproductive age where things are going to happen. The other thing is that once you start having periods, it is that you can become pregnant. So again, you need to have that discussion. We don't want people to be educated by your mobile phone. Parents need to sit down and have this discussion with them. The other thing I don't know is whether or not in schools, whether there's any provision by head principals, or might be able to answer this, to cater for these girls. They may have their first period action in school. And who could they go to? Is there a teacher or confidant that they can go to discuss this? Do we have sanitary provisions in schools for that sort of thing if it happens, whether it's in a primary school or in a secondary school? So that's the other thing, because menstrual problems are very wide and far. Young women as well might be having what we call cyclical pain because it's a monthly thing. And again, if you have a daughter and your father or mother, and they are single fathers and they have single mothers, your child might be having cyclical monthly pain and having no periods. And that is something that you should probably go to a doctor to see why it is that they're having this monthly pain but no periods. And they might say, well, the period ain't ready to start yet. And it may just be because they have a blockage to the external environment, and some people are born with that. So there's a little membrane there that blocks the blood from coming through, and that could have implications them for having one fertility in future, and secondly, a very painful condition that goes with a period called endometriosis, which I can probably talk about at another time because endometriosis is one of those things that cause painful periods, and it could be very debilitating and life changing for lots of women. So I just wanted to discuss that before. All right. Now, the reason why I want to have this discussion with Doug, it's because I have this keen interest. I have an enlarged prostate myself. I have prostatism because I'm at that age, and a lot of people who get into my age will have that. And
Explain that a little
in
bit. What is prostatism?
so prostatism basically is when the prostate starts enlarged, and you find that you can't hold your urine for long, so you have this pressure building up, and you have to run to the toilet if you feel that you want to pee. You can't hold things in. I'm not at that stage yet, but I'm saying it affects you. I actually started having medication, and that has sorted it out. The other thing is that you can get infection, which is prostatitis, right? Of infection of the prostate, and you keep going and coming, waking up at night, etc., and so forth. Ideally, we should be getting up once at night to go to the toilet. But if you're getting up 3 or 4 times, it means your prostate is probably giving you some problems. On top of that, you may be also becoming diabetic while you're peeing very often at night. But my father, who died at I wouldn't it wasn't the right polio at 84. When I was leaving St. Vincent in 1998, started telling me about having this prostatism. And I said, Daddy, it's probably a prostate. We had this long discussion. The lovely thing I had about my father in the latter is that we could sit down and we could have long talks about the end of the world. He was great at that. Um, it's probably a prostate that's giving you problem. And we had just at the time in hospital gotten in a probe, a rectal probe, because you could do scans that could scan the prostate and say, Daddy, maybe you should have a scan of your prostate, but it's something that have to go up your back passage, etc. and so forth. And he said no. And I had to have this really difficult discussion. I said, well, I can't make you have it, and that's always been my approach. You have to decide what you want, and I think it will give us a lot of clues and ideas of what's going on. We could act on it, and he refused. I told my older brother Sinclair about it. I said, Daddy's having this problem, and he may come to you because it's gonna get worse, and at some stage you will not be able to pass urine, and he's gonna come to you and so forth. Maybe you should try and encourage him to see a doctor. And my father, so I came here in October. My father didn't say anything about it. And somewhere in January 1999, I was speaking to him and he's saying, well, I have this problem when I go to the toilet. I stand up and I have to wait for ages for my pee to come. And it comes dribble and dribble and dribble and dribble and dribble and dribble and dribble. And then I spoke to my brother and simply took him to the doctor. And then we discovered he had this problem with his prostate. Now I said that to say that had his 4 months would have been an advantage for him. If he had said, well, let me go and see what this thing is like. And we have this thing about men that they don't want the back passage to be encroached on because it have this sexual connotation. And that would have given us a step in front of my father. But he lived from 1998. He died in 2008. He actually had 10 years after that. The outcome of that was really, in my view, and I is that at the end, in order to control his symptoms, he had to have what is called an orchidectomy, right? So that to me, and I'm the son, felt that we had to neuter our father in order to make him comfortable in life because he
What
had
is
this
it? What
condition,
is the orchidectomy?
right? So orchidectomy is that we had to take away his testicles because his testicles is the one that were producing the testosterone, and prostate cancer was being driven by this testosterone, right? But the thing, he still had 10 years. So he was lucky because in some cases, the whole thing could be so aggressive, and especially in Afro Caribbean men and Afro American men, for some reason, prostate cancer is extremely aggressive. You get diagnosed, and within 2 to 3 years, that's it. You know, I used to be so very embarrassed when I met my other uncle. I have another uncle died from prostate cancer. And he used to be talking this discussion with me and so forth, but he had a different problem. He was talking that he was not being able to get erections, etc., and so forth. And at his age, I didn't say he shouldn't have sex, but it was very embarrassing for us to have that conversation, me and my uncle. And always in the middle of the street. So I used to really have to hold my head down and say, Uncle so and so, you need to call me on the phone and we could discuss this, but not in the middle of the street because it was very difficult conversation to have. So that's the problem. I think what Doug doesn't know what I'm going to ask him. What I want to ask Doug is probably going to be monumental, in that it would be for the first time that somebody's, at least in my know, who's come out and is willing and happy to talk about this condition. All right. And I know I've raised a condition before on radio about when you get to age 40, you should go and get your prostate checked and have this done um annually so that you check it. And so Doug's story is that Doug was always out front saying that he goes and he gets his examination and he had his PSA done. Prostate specific antigen is the name of that, which is a hormone test, which despite the fact that it was within normal range, it had a slight shift. And he had a brilliant doctor to say, even though you have that slight shift in it, let us do further tests and see what is happening. And he was discovered to be at that stage. So my question to Doug is, when he was given this diagnosis to say, well, let's check it out further, and they come back and say, well, there's a bit of cancer there, and cancer is probably worst word in the world. It's really, really, really bad and terrible word. And nobody in some countries people call it the C word. It's not the C word. Cancer is a word that we should all be able to talk about. If you want to talk about C, talk about concern. C is about care, right? Um, so I want to hear Doug's reflection when he was told, well, I have cancer. What would have gone through his mind? You probably have prostate cancer. Put the prostate aside, being told that you have cancer, what that would have done to him as a person, and how did he reflect on that? Did he think, well, oh God, my life is over now? Or what was his thoughts?
Well, well, in my case, because of the type of work I used to do, my medical insurance is like A plus. So I always go and get checked. Every year I do my annual physical, and I got a doctor who I follow up with to do whatever, any little ailments I got, any little, thing I got, I go to him. It's a doctor I could talk to and everything. So about, I think it's 10, 12 years ago, my brother before me had prostate cancer. And he normally come to the States to get his physical done. And he has his doctors and them. And they decide, well, his doctors and them is in the States. They decide, well, the best choice for him is to remove the prostate. And that's his own personal friends and doctors. So in a particular year, they came to St. Vincent, about 7 of them, with all the backup teams, on January 1st, and did the operation at Milton Cater Memorial Hospital.
Oh, wow.
But being at the first of the year, big holiday in St. Vincent, nobody know who it was who had this operation with all these white people. Anyway, in his recovery, he talking all the time. He telling me to go get checked. And about 4 years ago, my oldest brother had the same problem. But he did his own hair in New York, removed the prostate. And I told my doctor, I said, look, I got 2 brothers who got prostate issues. He said, yeah, how old are they? I said, well, at the time, one of my brother was 55 and one was 5 years ago, so he was about 65. And my doctor decided to monitor my thing from that day. So every year I do my PSA and I do my physical and I go and I sit down with him to get the readings, and he goes through all this stuff. And he noticed that everything else is either down or the same. But my PSA moved from 0.50 to 1.05 in 1 year. Not a big deal. The next year, it moved to 1.75. So he sent me to the urologist right away. My PSA is 175. The urologist run me out the office. Yeah, he run me. He says, he called my doctor. He said, why you send him here to me? So he explained to him. He said, no, this is normal. So he explained to him that the movement is too high. It's too high for my age and for my physical structure. It is too high. They disagree. So every year I come up from St. Vincent. Within my first or second business day here, I goes to my doctor to do my physical. And this year when I come up, my PSA moved from, I think I did another year, which I skipped, dealing with the urologist, and it was 220. And this year I came up, it was 265. So my doctor sent me, he said, listen, you see they say, take it straight over to the urologist's office, which is about 5 minutes away. He said, take it there. And any problem, call me. So I see the doctor see me. He says, I haven't seen you in 2 years. I said, yeah, you run me out your office the last time. So he said, anyway, let me check. He said, this is normal for your age. 265 for your age. It's not too abnormal. I said, yeah, but Dr. Scott think it is. He said, all right, let me check. Then when he checked, physically checked my prostate, I hear him saying, Then he comes back and he tell me, you got lumps in your prostate. We got to do a biopsy. He did 12 specimens. I go back 2 weeks later, which was June 24th of this year. It come back, 8 of them positive. But in its infancy stage, he says. He said, this is infancy stage. He said, these are your choices. And I went back to my general practitioner doctor, had a conversation with him, talked to my brothers, talked to a couple other people, and I explained to them, I ain't gonna monkey around with this stuff here, because I see too much of my friends monkey around with that stuff and lose their life, including Randy D, of which I had a long, he had many hours of conversation over the same thing. I went back to the doctor. I did a follow-up for the biopsy. When the biopsy come back, it says 12 specimens, 8 of them positive. He gave me the notion, and I tell him, I say, look, this is, he said, this is your option. I say, okay, this is my option. If your right hand offend you, cut it off. Take it out. He said, you could do cyber night, you could do this. They got all kind of treatment you could do. I say, yeah, but the hand's still there. And it offend me already, so I got to cut this off. So that's when I make the decision to do radical surgery and remove it. And I told my wife what I was going to do. She started crying. I told some of my good friends who is listening to this program right now what I'm going to do. And some of them didn't agree with me. They think I should go other options. But I think when you take it out and get rid of it, you ain't got no other option. It ain't got no other option to come back. So anyway, I did my bone density and my bone scan. Everything is good. So it shows that the cells of the cancer is contained as of now within the prostate area. So my doctor tell me, who did my surgery, very good guy. He tell me, say, as of now, we going good. So I said, so when we gonna do the surgery? He said, we gotta get a date. So I tell him, I thought you were gonna do it yesterday. He said, no, 2 weeks ago. Anyway, we had a little joke. So we had a little talk, different thing. And he tell me gonna do the surgery on the 6th. And I was
Okay.
prepared.
All right.
I,
So that was your initial run up to it and so forth. Just
yeah.
let's talk a few things here because and I think you're well, I don't know what you call them in the United Kingdom. So your general practitioner, we'll call them GP, which is ordinary day to day doctor, was
Uh-huh.
really smart. Because here we are looking at numbers. So I am glad you brought it up because people could get falsely reassured. My numbers are okay, so there's not a problem underneath. I don't need to do anything further. You know, you go and get the blood test, and the blood test is fine. Your prostate levels are normal. But if you are having symptoms and if you are curious, and as you had there where your doctor said to you, let's go and check this out, because it wasn't rising slowly. It's a sharp rise. It's a steep rise. What we would call in medicine an exponential rise of your PSA, even though the numbers were normal. And so this is the whole thing about it. So when we come to tests in the body, we have something we call tests that are very specific and tests that are very sensitive. The thing about the PSA, prostate specific antigen, it is very sensitive. It will pick up prostate activity, but it is not specific to prostate cancer only. So there are other things that goes on in the body that can cause your PSA to rise. And I
Mm-hmm.
suspect that is what was behind, especially saying, well, it gone up a bit, big deal. It might be something else. So I think kudos to your doctor for persevering to saying this needs to be looked at. And the other thing that you mentioned is that when he examined your prostate, because the prostate basically, if you could imagine the seed of an avocado, a lot of us, with Vincent, you know what an avocado seed looks like. That's probably the size of your prostate. And it sits just below your bladder and between your bladder and your penis. So the tube that comes from your bladder through which it passes urine passes through the middle of that avocado seed, if you want to call it, and then it continues along outside along your penis and so forth. So when that avocado seed, let's say it was soft like a sponge, when it starts to swell, it puts pressure on the midline. And if it's gonna put pressure on the midline, it's gonna squeeze off that tube in the middle, right? If we feel the avocado seed when you have it in our neck, it feels nice and smooth and wrong outside. But your doctor felt bumps. We would call that in medicine nodules. It felt
Right. That's
nodular,
exactly what he said.
right? So nodule. So that's an irregular shape. So nodule tell you that there's activity going on underneath. Now, imagine if you will. So rather than having the avocado itself being covered outside with this, we normally take off the avocado skin. Most
Mm-hmm.
of our, not most, the prostate is covered by what we call a capsule. So the capsule will be something like the avocado skin, but instead of it covering the outside, it's covering this hard seed that we have inside. It's not that hard, it feels firm, but it shouldn't feel hard unlike rock stone. So that basically the nodules was still under the capsule, which is a good thing because once the nodule and the cancer break through the capsule, it means that you have had spread to other parts of your body. Now, those other parts, basically, and prostate cancer is very notorious so that it spread to your bones. It spread to your bones, and in your bones, it causes what we call lytic lesions. So lytic lesions mean that if I scan your hip, you will see like your hip has several holes in it, like a honeycomb,
Mm-hmm.
etc. And that's end stage. Once it's got to your bone, there's no way nothing we give you will ever cure it. And we can prevent us getting to that stage where you have what you call metastases spread. If we were to do these examinations, allow your doctor to feel what your prostate is like. Now you can do ultrasound scan as well and scan the prostate and see its configuration and see things is ready. And lots of other tests are coming along well. So I really have to say your doctor was very, very good in preparing you for that. But did the word cancer itself put the fear of God into you and you feel, well, I'm going to die now? And were
Nah.
you in despair, or did you say, fine, this is a problem, I have to tackle it head on? Because this is where, as an individual, words carry a lot of power. And if somebody, I'll give a typical example of me, a doctor. Um, my mom was never diabetic, and she went to the stage and she sat in the house all day. That was the time of O.J. Simpson. And when my mother came back, she was felt unwell. And I said, no, my mother couldn't be diabetic because she's so slim. She doesn't eat a lot, etc. and so forth. It turned out she was diabetic. And we took her to hospital, and her blood sugar was sky high. And I panicked and froze. I couldn't treat my mother. I had to get one of my doctors, my colleagues, and call me and say, look, my mother blood sugar is very, very high, and I don't know what to do. They see me going crazy now. Should I start to give her insulin? Should I start to do this, etc. So forth? So words, a single word like that could put you into shock. You tell a patient you have cancer of your prostate, he then goes out and panic, doesn't go back to see his doctor and get it followed up and so forth, and afraid to come to that thing and so forth, and you have a lapse of 4 to 5 months, and when they come back, it's too late. All right. So
Well, it never it never scare me because I kind of built a little differently. These things I don't never get scared about these things, or I never panic because like some people you tell the first thing they say, oh, I'm so sorry, and I tell them, nah, I'm glad, and they watch me like if I'm a nutcase when I tell them I'm glad because I glad I catch it in the stage where I catch it because I coulda say, well, oh man, that thing is only 265, man. Let me go and go my business instead of take off the time to go and deal with it. I could have said that. And next thing I come back next year, the year after, if God's willing, next thing it done jump from the prostate into the rest of my body. And that is one of the problems why I am so grateful for this program and for this and to have this conversation because you'll be shocked. I don't know if you guys gonna be shocked, but it always shocked me the, the type of brothers who will talk the kind of nonsense that that man, me no faggot, me want nobody stick not me ass and all this kind of thing. And then later on in life, they get sick. Like me personally, I had no symptoms. My normal get up in the night bathroom was the same. I ain't had no no clue that nothing going on inside of my body like what was going on there. And I guess because it was in a very early stage. But my point is, I have no clue. So now you got brothers who walking around with prostate cancer still containing the prostate and thinking if they should get it removed, what they should do. And listen, these are things that are so aggressive in black, as Carlyle said, African American, well, it's African period, men. These things are so aggressive and it have some cancer, especially one where my brother had, right? Not my older brother, the one before me. In him, the doctor tell him, partner, you got one of the worst cancer because if this jump, you're done. So he had his prostate, and he had a low PSA test like mine, but the same thing his doctor find out that it move higher abnormally. Because according to my urologist, he was explaining to me, if your prostate numbers moves, it's supposed to move no more than 7% a year upwards. That's normal. But mine own was going up like 25%, 30%, and more. A matter of fact, one time it go from 52 to it go from 0.50 to 1.05. It move up 55 points. So that's 105 points it move up in 1 year.
And the thing we must note here, Doug, is that you have a strong family history. And this is the other thing that people need to take note of. If you have a
That's why
strong family, your brothers had it, It's just so in my case, I have uncles had it, my father had it, and so forth. So I have to be on that spectrum of alertness. But when people refuse to have examination, that is what I call as a doctor dying of ignorance. You go
Yes.
to that you die of ignorance. And the other thing is when this thing spread to your bone, bone pain. Oh my God! I, as a doctor, when I go and I see somebody in bone pain, nothing you give them takes that pain away, right? One of the things that put this whole fear of this prostate thing in my mind when I came back as a young doctor, one night I was on call to come and see a person who couldn't pass urine. I kid you not. This chap's bladder was up underneath his belly as if he was pregnant, 9 months pregnant. That's how much water you take. Now, when you have that problem, is obviously that's gonna back up and affect your kidney as well and so forth and what's not. And you had to put a catheter in for him and to try and relieve him of that foot. And I tell you, I went home that night. This is many, many years ago. And I said, oh my God, please, when I get to this stage of my life, if it's one thing he mustn't give me, is this thing. You know? I am telling you, I prayed and said, God, please, when I get to that stage of my life, don't give this to me. Give me anything else. Right? So we come back to you then. So you've had your diagnosis and you're planning to have your surgery, and you chose open surgery. That is to have a cut in your tummy, did you?
Yes.
And
Yes.
and to have it removed then. But what other
Yes.
options did they give you then? Because I
They
think
give
at
me
the moment we in St. Vincent, we probably only have the cut and the tummy option. I stand
so
subject to
uh,
correction. I'm not a urologist.
mhm.
We have a resident urologist in St. Vincent, and I don't want to take his steal his thunder. And maybe he could call in at some stage and correct what I'm saying. But I think that's what's available to us. Yeah.
Well, give me they have they have a new thing with NYU, which is one of
Mm-hmm.
the hospital that I go, but I only go there for my dermatology. But
Yeah.
I talk to some of the people there, and they recommend me to go to this particular doctor. He do a thing called cyber night,
Mm-hmm.
and
Simon Knife. Knife.
yeah, he's one
Yeah.
that's in that, and
Mm.
you don't have to remove nothing. Then my urologist and my other doctor, my
Mm-hmm.
my my personal doctor, he tell me, well, you got um radiation seeds implant.
Yes.
Where they take seeds and radiation seeds and put them directly into the prostate and leave
Yes.
them there, and it will do the
Kill off the cells.
kill off the cells. But
Mm-hmm.
one thing with radiation, when you read about the side effects of the radiation, is that the radiation, what they was going to give me, if you put in the seeds, you can't be wrong, no kids. Your body will be your, like for instance in New York City where they have all this scan for it
Yes.
for thing now. Once I go to the airport, I will have to travel with a particular card all the time
Yeah, you
because
walk a nuclear bomb because you give enough radiation to other people and you can't sit next to people as well.
and
So,
so
yeah,
you can't sit next to, you shouldn't be around babies and little children. It has its downside, but
yes.
this is the part, this is the kicker that really get me not to go with that. You will do that, and what the chances of it not returning? He can't give me the percentage. He have seen people did that, and it came right back 10 years later, 12 years later, when they couldn't do the radical surgery again because they get older, their bones are weaker, and stuff like that. That's what he was telling me. So since I got all my A's in the same place, I
Your
agree.
wet draws.
Eh? I agree to go with what I choose. And I think I
But
talked to my brother, like
the
I
other
said.
thing to that, dog, though, is that when you have the radiation seeds implanted into the prostate, apart from the fact that they can't be around these things, etc., is that that radiation is also given off to the bowel, right? So your large bowels and your small bowel, and you could actually end up having cancer of the bowel as a result of the radiation. Now that cancer doesn't come up right away, and so on, and that goes for cervical cancer as well. When you have radiotherapy to your cervix for cervical cancer, one of the downsides to that is that your bowels take a good blast of the radiation, and you end up with having bowel cancer many years after 10, 20 years. Now
Mhm.
doctors will measure that to say quality of life. At least you had a good quality of life for another 20 years. But the fact is, one cure led to another disease.
Yeah, yeah.
Yes.
And
All right.
that is why I choose this one, because if the right hand offend you, cut it off.
Yes. So there's laser and as you say, that we could use. There's a new therapy coming along as well where you could use water actually to let laser out the protein side. The things about those is that they destroy the tissue. So so laser for instance destroys the cells and so forth. So you can't get a pathology specimen to look at it to see after that, well, you had the cancer, to what depth it was, etc. and so forth. Which sort of put you at a disadvantage. And so
Mhm.
then your doctors have to still keep a very close eye on you because they don't know really and truly what stage your cancer was. In your stage where it was a stage one, is a stage two. And you mentioned your brother had thing because we think, well, all prostate cancers are the same. All prostate cancers are not the same. All organs in our body are made up of different cell types, and you could get a cancer of those different cell types. So some skin cancers have grow very slowly. That's because they're what we call squamous cells and so forth. But when you have glandular tissue, if you have a glandular cancer, they tend to spread very fast. But not only that, glandular cancers also tend to produce hormones and other things that give you lots of other side effects as you go along. So I think that is where so your cancer type is
Mhm.
different, right? Your cancer, most cancers are also staged, right?
Mhm.
Basically, stage one and stage two and stage three and stage four is the worst. If you're stage four for any cancer, it means it has already moved to your, it's spread. It's gone to
Mhm.
your liver, your lungs, your kidney, your brain, or whatever. That's a stage four. Stage one is probably the best stage to catch it because it's still within the prostate and so forth. Yours didn't breach your capsule, but I don't know what depth it was. And when you look at depth, you're looking from the inside, so the inner tube inside, and how did it penetrate from the inner tube inside all the way out to the thing, which would have been probably a stage three, right? And I don't know if they take what you call node biopsies because when things spread, they spread by lymphatics. Your lymph system is the other system in the body that we don't care of, and something spread by blood. Prostate cancers tend to spread by blood rather than by the lymph nodes. So that's one of the other things about that disease, basically. Now, having said that, and you were preparing for the surgery, did you read a lot about it, or you just say, "I'll take whatever come with me," etc., and so forth?
No, I read about it. I read the
Mhm.
upsides and I read the downsides. And the upsides, the positive parts of it, is the is without with the negative parts of it. So I just figure, well, is it things gonna be different a little bit, but at my age, I ain't looking for no kids.
Mhm.
That is even better for me to guarantee I ain't got none. Because when you got a kid, you gotta put another 20 years in that kid. Otherwise, you become a sperm donor instead of father. So so if I have another kid at my age, it means that I have to go and spend at least another 15, not 15, another 20 years to get that kid to the point where they could hold their own. Because you got to make sure they got all what they need to get through this to get around in this world. So that is a guarantee I ain't gonna got no more kids. And for me that is even better. A lot
Yeah.
of people a
So,
lot of people wouldn't say that, but that's how I feel.
all right. So, tell us who were on your surgical team. So, you would have had your surgeon, your primary
Yeah,
surgeon.
I
Who were the other people that made up your team who are going to care for you when you get to hospital? Of course, nurses, but
yeah, I had the main urologist, and he had with him two more urologists and another doctor. I don't know what he did,
Mhm.
but he come to see me first, and he see me first, and he see me last.
Is that the
He let
anesthetist then?
I Could be it, but his assistant was a urologist. He come to see me too, explain to me. I had the anesthesiologist, right? So
Mm-hmm.
that's one, and four is five, six,
Mm-hmm.
and four nurses.
Right. So physiotherapy nurse?
I don't know. No, I
No.
think one of the doctor,
Mm-hmm.
one of the doctor was a nerve doctor.
All right. So no physiotherapist. And
No,
did you have a continence nurse?
no.
All right. Okay. So in preparation for these, sometimes you have these people, what we call a multidisciplinary team that come to see you.
Mm.
These days, to in really advanced centers, I don't want us to aspire to this intimate, and I'm talking about is that we have robotic surgery as well, and so forth.
Yeah,
And so they have a physiotherapist to come in and speak to you, etc., and prepare it for the fact that the evening of your surgery, once the robots do the surgery, a lot of the times they actually get you out of bed the very same afternoon for your surgery. So talk us through what your day was like when you went in the hospital, what did, and then
well,
and what happens.
one of the things I wanted, one of the things I asked the doctor for was I want to get up as fast as I can. I want to get up and start to walk because I read that once you have these kind of procedure, the best thing to do is walk to start to build back up your stamina because now you got to be building back muscles, but you can't overdo it. So they tell me no, you can't come out of bed until the next day. They insist because the night when I come out, I was feeling very good. I was feeling good.
Hmm.
Little pain, but normal. But I was feeling good. I was feeling very good, and I didn't have no kind of setback. Matter of fact, yesterday I went to the doctor, to the urologist, for my week checkup, and he said, "Man, you're doing good." He take out all the stitches yesterday. He pull out the tube that we call it a Johnson sprat.
Johnson's drain.
Yeah, the drain. He pulled that out yesterday. He said, "This is good. You don't need this no more." So the only uncomfortable thing I have in is the catheter.
Okay, fine. So yeah, so with robotic surgery, they actually get you up the same day and get you out. I know my friend in Canada, he had the same problem, and he had his surgery in the morning, and by 4 o'clock in the afternoon, he's up and about walking the
Yeah,
grounds of the hospital. So it there's no, and that, again, the other thing I want to transfer to people is that there's no right way and no wrong way about approaching things. Everybody have a different method of approaching things, etc. What is important is the outcome,
but
the successful outcome. Yes.
Doc,
Mm.
they had another alternative that I talked to the doctor with. They had an alternative where they give you, I don't know if it's injection or tablets,
Mm-hmm.
and it will shrink the prostate to the size of a grape,
Yeah.
and then they will go in how much ever months after and remove it.
Yes.
But that
Okay.
takes time.
Yes. So,
That
so,
time to shrink it down to that.
so what you're talking about is something called GnRH analogs, right? And GnRH means gonadotropin releasing hormone analogs. So what this drug does basically is that all our hormones in our body is really controlled from a central point in our brain, right? That
Mhm.
sends messages down to what we call the midbrain, and then the midbrain sends messages down to our different organs in our body. Sends messages down to, in case of women, it sends messages down to the ovaries. In the case of men, it sends messages down to the testicles. Yes. So
Mhm.
when you give somebody these drugs, basically you shut down that system up there. So it doesn't send any pulse messages down to these organs and so forth. So as a result of that, the organs shrink. But hormones have this funny thing. They have what you call down regulation in that case when things shrink. And then after a while, this is what we discovered called upregulation. So it starts causing the opposite. So for instance, when we discovered these things called GnRH analogs, we thought, fine, we wouldn't have to treat women for fibroids anymore. You put them on this stuff, it'll shrink the fibroids and it'll go away. Little did we know that after 4 months shrinking the fibroids, then the fibroids start getting larger again because they start upregulating. So we haven't made that breakthrough yet in terms of how we could control these hormones to make them act in one way only, right? So what they now do is use it as a tool. They say, all right, if we put you on this drug for 4 months, it will shrink your prostate down to a certain level, and then it will be shrink. Because what we're looking for is that when you go into your tummy to do the operation, we want space. We want to be able to see things clearly, right? And that's the advantage that the robot has over the naked eye. If you put cameras in with the magnification is 100 times what your naked eye would see. And so even if you have a little tiny lump, you will pick it up with the with a robot. You probably wouldn't pick it up with the naked eye or the human being. So I think that's the advantage of robotic. One of the major advantages of robotic surgery where things are going now. Like I said, we can aspire to that in St. Vincent at the moment, because it needs highly trained people, and probably that's for the younger generation next 20, 30, 40 years of stuff. So you had your surgery in the morning.
In the morning.
Uh,
They're going at
yeah,
start at 8
right. And how
and
long did your surgery take?
they finish at 11:20.
11:20. Right.
Mm-hmm.
So you woke up in, I would call, recovery,
Yeah.
because it was straightforward. You didn't have any complications. Because one of the major complications of of this sort is really massive hemorrhage and bleeding.
I
But
didn't you see I didn't have
medicine,
no
yeah, medicine is one of those sciences that improve with time and so forth. So as we have greater knowledge, people apply those knowledge, and so forth, so that for a person to bleed significantly, and this was used to be one of the worries in St. Vincent, that when you're going to operate on your prostate, after that you're in hospital for days and end because you bled so much. Because the prostate, that seed that I spoke about, the avocado seed, sits at the back, just below where your spine goes over into your pelvic canal. And there you have a complex of nerve roots, and you also have a complex of blood vessels. And in the days gone by, we didn't have things that you could cauterize things, etc., and so forth. Where you cauterize mean that you block off the blood vessels so that they
mm-hmm.
don't bleed. You literally used to be very crude, where you rip this thing out once you get to it and so forth, and then you have these vessels that used to bleed. And in order to stop them bleeding, you used to have to what, tamponade them. Tamponade means stop, put pressure on them, and eventually your clotting system will come into place and it stop bleed. But it meant that when you went back to the ward and so forth, one of these times your blood pressure goes up, because anytime you get an anesthetic, basically, your blood pressure goes down. Anesthetics control your blood pressure goes down to the normal. But once the anesthetic starts to wear off, your normal blood pressure comes back up. So there, if there's a tiny vessel there that didn't close off, it could start bleeding, and you end up with lots of blood in your belly, and then you have to go back to theater for them to find out where this bleeding is. And I have to say, in all my years in surgery, going back to theater with a patient, we have never ever discovered the bleeding. And this is in St. Vincent as well as in this country, but for some reason the bleeding stops. So it's an interesting phenomenon that you're going back in to look for something and then you can't find it, and so forth. Where it is. So the day after your surgery now, or well, post-operatively and thing, what did you have in terms of pain relief? What did they offer you?
Just regular Tylenol that you could buy in the corner store. Because I tell them one thing I don't want. I don't want none of them opioid stuff.
So you did
Pain.
have you did have a choice of having opioid things by,
Yeah.
yeah, by injection or by machine.
They would do it by jips. Put it in the jip bag.
Yeah, but that is what you call a PC, a patient control apparatus. So when you feel
Mm-hmm.
pain, you press a little button and it gave you a little
Yeah.
dose
I
of
want
opiates. Right. The alternative would be that you have injections of the opioids, etc. But you opted not to have those, so you just
none none of them.
use Tylenol.
Re-
Um,
Regular over the counter 350 Tylenol.
Tylenol. So,
Yeah.
which means that you're a strong man, because I think I would have been in such agony. I would have want him to give me, even knock me out with a hammer on my head, because I have a very a very low pain threshold. Um, and what did you have for anti sickness though? Because sometimes you have really bad nausea and stuff and so forth. So
He
did you
give
need anti sickness?
you mean antibiotics?
Not antibiotics, anti sickness to prevent you feeling nauseous and vomiting.
No. They
So you
ain't give me
didn't have that, right?
nothing.
So again, you did, and the reason why is that you were pregnant on Tylenol. Tylenol will not normally cause you nausea, but if you were having the opioid and the opiates, one of the side effects of those is that they really cause you to feel sick, right?
Mm-hmm.
Nauseous. and then you want to vomit. So they would give you an anti-sickness injection
Oh.
along with the opiates, etc., and so forth. But there are other means as well, and so forth. Some people do your surgery under spinal anesthetic. So when you wait, so much mean that you're awake. That is done in some centers, not all centers. Or they do it under general anesthetic, in which you are asleep. Um, so general anesthetic, as opposed to a spinal, which is what we call a regional anesthetic, you'd be numb from a certain level down.
Mm-hmm, mm-hmm.
Um, Stuff. But the other sort of painkillers that you could have patches that you could put on, that will take away pain for a long while. And then the things such as what we call TENS machines, right? Trans electronic nerve stimulators, which you could put on your back at the foot. And when you feel pain, you press it and they give you a little electrical shock, and that helps you with your pain relief, right?
Nah, I
So
didn't have
post
none of
op,
them.
yeah.
I didn't have none of them.
Oh, brilliant. So post-operatively now, some of the things that you have, apart from you seem to be in proper good pain control and so forth. But again, the thing is it passing urine.
Yeah, it
That
going in bad.
it goes in a bag.
Yeah.
And it is bloody first stage, and some people might say, "Oh my God, I'm bleeding to death," but that is just the aftermath, and eventually it clears up. Was that what you experienced?
No, because the first the first time when I see the nurse um drain the bag, the nurse
Mm-hmm.
said, "Wow, just a little bit of blood." That's the first time when I wake up before they carry me
Mm-hmm.
to the room.
Mm-hmm.
When they carry me to the room, I drink a lot of water. They said drink a lot of water. So I drink a lot of water all night. I drink the water. When the lady come and do the, she had to take it and measure it in the urinal to
Mm-hmm.
give the doctor how much urine I pass, I guess.
Mm-hmm.
And when she do that, it looked just like a little shade of yellow water because I drink
Okay.
so much water. So there was no blood.
Right. So
None.
so so so, so that's good, because what they do is that, like I said, this little seed that is between the bladder, and they take that out. So there's a portion of tube in that. So then that goes, and then they sew the top of the penis, the tube of the penis, back to your bladder, right?
Yeah.
And
Yes.
so that must have been properly sealed off now, so that there was no bleeding into that area. So which is great. And then the catheter passes up, pass through that junction where you would have joined, and it sits in your bladder and cause you to pass urine, so that you don't put any strain on that. And in about 7 days, that thing's probably heals quite nicely. You don't really have a problem with it. The problem post-operatively is that sometimes the catheter kinks, or the bulb inside where they should have holes to let the urine is, that gets blocked with blood. So
Mm-hmm.
you come out of surgery and your bladder starts filling up because it's not emptying, and you're in pain.
Yeah.
Yeah, because your bladder is over distended, or sometimes it kinks. Now, post operatively, there are some complications. Well, not complications, some life changing events that go along with having your prostate removed, right? One is that when you ejaculate, sometimes, no, and your man, sorry, we're talking about adult things, is that the ejaculate, rather than coming forward, it goes back up into your bladder.
Right.
This is called retrograde ejaculation.
And you pee it out in your urine.
You pee it out in your urine, and you were informed of all of this. The second thing
Of
is
course.
you have problems having erections. So people call it impotence,
Uh-huh.
right? Because potence means the ability to have erections, which I think is what worries a lot of men.
Of
But
black men.
the yeah. So I
That
I
that
I
is
are
like
you are you
that that
psychologically prepared that might happen to you?
well
And yes.
well if that happen, me really got no problem. But
Hmm.
I could tell you one thing. It ain't gonna
Yeah.
happen because the other night, the other morning I get up about 2 o'clock with one pain in my belly. But my brother they don't tell me. When I look down, you won't believe what I see.
Okay, right. So that is good. So again, impotence only infects about 10% of people. And in some people it takes like about 8 to 9 months sometimes. So it's for your potency to come back. So with you, it
Right.
seems like it's coming back early, which is again is a good sign,
That
and
is
that has
not
a
good.
lot to do with your surgery and how many nerves you disrupt while you're doing the operation that may cause that to happen
Yeah, but
post-operatively. Yeah.
I, I don't think that is the best because the kind of pain that
Mhm.
it it put on your whole system. You're
Yeah.
already in pain, but boy, that
Yeah.
pain ain't no joke. You had to take
Well,
you had to take 3, 4 Tylenol.
right. Okay. So the reason why we're discussing this because people will be apprehensive to go through this process and say, I'm going through that because this is what's going to happen to me after, etc. and so forth. But here it is, we have you as an example who's saying, well, I've gone through it. It isn't that bad. And the post operative things are not that bad either, and that there is a lot of positivity in a lot to do this. No, again, my question is getting people to have a positive outlook about things. My thing as a doctor over the years, I find when we're dealing with people, when you become very negative about things, you go downhill, and you go down really fast because I keep saying that I think your stress hormones that you put out have a way of dampening the response of your cells, so your physiology becomes dampened.
Mm-hmm.
Your instinct and your ability to say, "I'm alive and I'm going to go forward. I'm going to beat this" goes because you've had that negative approach to things, and so forth. So I think I might have, and thank you for this, gotten across that what I wanted to talk about, and really grateful that we could talk about it today, and that I hope people are listening. And if you have these problems, that you will go and check on it early and so
Yeah,
forth.
but
Because yeah,
mm,
go
one of
ahead.
the things I would like to say, Doc, one of the things I like to say with this, and that is why I have no problem having this conversation with anybody, because some people think, you keep certain things private. Listen,
Yes.
you have to be mindful that the downside of the foolishness that I'm 65 years old and I still want to act like if I'm in my 20s when I was growing up. And I don't want to lose what I had in my 20s and 30s at 65 is foolishness, in
Hmm.
my opinion. What kind of macho man you want to be? Who is going to who is going to refuse to take care of your health, and then 2 and 3 years down the road you're in a bed crying for pain? You, instead of you ask a doctor to take his finger and check your prostate, you are now asking the doctor if he could take the hospital and put up in the rectum where you didn't want to go in the first place to cure you. I have seen that with some people who have gone who didn't have to go like that. And and
Yes.
and and, and that is a sad situation. And some of the people that you won't believe it, some of the people is highly business, highly educated. They are very educated people, people who read the negative and the positive, and they so do choose the negative, and then later on they're begging the doctor. They're going to all hospital all over the world, they're flying, trying to get what they could have take care of before, take care of now.
And you haven't said, it brings me to the point that I want to make about, you hear me this week I was saying about myself. My next biggest event in my life will be my funeral. I'll be there in a little
Yes.
box. I'll be there in a little box. But there is something called a good death. And when we don't care for ourselves and we have things like cancer that we wait late, we end up in a stage where we're doing all the things that we need to do, passing urine, the other stuff, etc., and so forth. Somebody has to be around us, we're in pain, we can't sleep, we can't everything else and so forth. And timely intervention and timely activity would prevent us from being in that state and so forth. Tomorrow is 5 years since my mom passed, and she went to bed a Saturday night and didn't wake up. And sad that it was, and totally unexpected, by the way, and so forth. I give thanks for that, in that she didn't die in pain,
Suffer.
wanting to have 24/7 vigil, people around her having to get up and give you pain relief to put you back to sleep, etc., and so forth. So I'm thankful to God for that. That
Yeah,
where that is
that
concerned. And hello, yes,
when you look at it again, when you look at it again, now I'm home. I came home last Saturday, right? So a week ago today, I came home. But when I look at it from this point of view, now Joy take off the week to do certain things for me, and I'm glad she was here to do it, right? Now, when you have some of these things and you let them go long for this long period of time, you have to have outside care, people who is outside who has to come in to care for you because you can't care for yourself. And you put stress on your family members, you put stress on your children, you know when they could go and doing something for themselves. Because of your ignorance, you now have to come and take care of you. And if they don't come, you go say, well, I take care of you when you was growing up. Now I need the care. You didn't take care of me. But in this case, in this particular topic that we on, you could have taken care of that when you had the opportunity. A lot of us. And
yes,
if you don't, you put too much pressure on the rest of your family.
that's right.
But
Yes,
here's a question, Doc. Doc. What is it that we can do as men to perhaps delay this particular situation or postpone it altogether?
God, I think, oh, if I had the answer to that, I'd open an office tomorrow and tell people come to me only.
I
It's
think the actual
the
answer
I
to it
think
is
the
that is
yeah,
that we should not be afraid. Should not be afraid
yeah,
of getting
it's
examinations. People of our age and race in particular, could be sometimes hesitant to to
yeah, so it's
explore.
breaking down the barriers and dispensing of the taboos around such things, and in particular having a digital rectal exam. Um, and a lot of there are lots of female doctors. If you don't want a male doctor, go to a female doctor. They have lots of female urologists around and so forth. And a lot of the people who works in sonographic departments, the ultrasonographers, tend to be predominantly female, not male. So you may have that choice. Sometimes you don't. I work sometimes and women turn up. I mainly work in obstetrics, and they'll say to me, "Well, I don't really want a man to examine me," and I said, "That's fine," and I'm not offended because that's their choice and so forth. But it so turns out I say, well, I'll try and get a female colleague to come along and do the examination and so forth. But at night when you're the only person there and you don't have a female colleague, eventually that patient has to come around to say, right, I don't have any option. It's my baby or the exam, and they would allow you to examine them, albeit it's not the most friendly and patient acceptable manner.
Now, Doc, I don't know if you're looking at your screen, but I would have.
I saw your demonstration, your pictures there.
Yes, okay, and I'm hoping we can use this better going forward. I actually just picked up this computer. Actually went in for repairs. The computer facility in this went in for repairs, and I didn't pick it up until this morning. So I was not completely prepared. But it basically is what. So what we're looking at there, I don't know what size screen if you're on your phone or you're on a computer,
No,
Doc.
I'm on my phone.
Okay, you're on the phone. Okay, for the listening audience, I don't know if you could look at it closer. We have a picture of the male reproductive system. Doc, is there any way you could indicate as to um, if there's any way that you can do self checks, if you can do some way you can test yourself, could you give persons information as to where the prostate gland is located, and how.
But
Mm,
well, like I said to you, right? Your spine comes down. You have what you call your lumbar spine, and then you have the rim of your pelvis. Yeah, and then after that you have what you call your sacral bones. So the prostate sits just above where the spinal bones change from lumbar, which is in your back, to sacral, which is in your bottom, right? So this prostate sits around that region,
So it's
and
kind of
it's
like
about
where you
it's
sit. It's kind of like is it kind of where you sit?
yeah,
Yes. Okay.
yeah. And it's about 6 inches away from your anus, so you should be able to feel it with your finger. But to tell people to go and do their own self-examination, that would be erroneous because they don't know what they're looking for and they don't know what they're feeling. So
Exactly.
that's why you have to leave that up to an expert. So I wouldn't encourage people to do a self-check for the prostate.
Okay.
I would say the chances are to look at your go and let the doctor feel and see what the doctor feels. And if the
But
doctor is certain, we have other things that we can do, such as the PSA, like I said, and scans.
Okay.
but
Is there
let me
any?
tell,
Go ahead, Doug. Yeah, go ahead.
let me tell you something. My doctor always does a physical exam of me, and my doctor did a physical exam on the 21st of May this year, and he never picked up the nodes, the nodules, until I go to the
Urologist.
urologist. He picked up the nodules, and my doctor didn't pick it up because, according to my urologist, I don't know, he says the nodes was deep. I want to know what the hell he was talking about. But they wasn't out to the skin. They was deep, according to him.
Yeah, but your urologist will be accustomed to the feel of the prostate,
Right.
and he will be accustomed to know how much pressure to put on, because the prostate. I mean, I've not really told you the true story, because it has what you call a left lobe, it has a right lobe, and there's a little piece in between, a middle piece, which is called the middle lobe. I didn't want to complicate things, so people just wanted to keep it simple. And he knows that he has to feel all of those and so forth, and to how much indentation you could try to indent the tissue itself so that you could feel nodules within. So a lay person like you and I, well, I wouldn't call myself a lay person in that way. A lay person who hasn't done that before wouldn't be able to tell that. So that is something you have to leave to the experts.
Yes, I think that too, Carlyle, because my doctor been around for almost 40 years, my regular doctor, and he didn't detect no,
No,
and
but
he been doing
Carl,
that.
contortionist, if you want to put his hand up at his bottom like that, I mean, I can't understand that part there.
No, no, no. Not necessarily that, but I understand there's things called Kegel exercises that is practiced. Doc, is any way you can where you can get into that? Not necessarily going intruding, not necessarily going inside, I don't know
But but but
the
but
place
but the
between
key.
between your testes and your anus, like that is something that is where that where the prostate gland is actually located.
No, between your testes and your anus, that's called your perineum. Your prostate gland is deep with it. The prostate is in your abdomen, basically.
Okay.
Right. So,
So
and then
sitting down
Kegel's
on
exercise.
harder surfaces, Alwyn, I was wondering if that in any way can affect the speed of your prostate progression.
No.
Okay.
As far as I know, no. Yeah.
All right.
Right.
Any questions from the audience? 456-5967, 718-734-5615, or WhatsApp. Somebody reminded me that I called Mr. Fraser's name incorrectly this morning. I actually called him Mr. Thomas and not Mr. Fraser. We have a call on the line. Let's see who's on the line. Nice radio. Good morning.
Good morning again, Carla. Me again.
Hey, Biggs. How's it going?
I really enjoying this program, eh? Doc, you're doing a wonderful job. And for me, the first time I did a PSA at a time with Marie, and it was okay. But the only time is when I took ill and went to the hospital, I had a physical examination. And trust me, for what I'm hearing about prostate, any time at all, I have to get this done. I do not mind nobody check my prostate physically. Trust me. because it's not easy. It's not easy going forward. If you're here to pick up any unusuality in the prostate, I saw a friend of mine, real good friend. I did not even knew that was the last time I was going to see him. We both used to go to the outpatient clinic at Dr. Badnock. I know Dr. Badnock is one of those persons who are in that area, of prostate cancer. And when somebody told me the individual passed, it was like a shock to me. Wow. For me, Carlyle, if you have to, if something, just like I was going to tell you this today about the poisonous thing in the arm, which Carlyle, I don't like to hear me speak about it. I'm not telling that to do it, but I'm telling the Carlyle, do not back away. If you feel you have to go and get it done physically, tell them you want it done physically. Because if that is what's going to bring out the real results, Carlyle, don't hesitate, my friend. You're my brother and friend, don't hesitate. It's not a thing. Maybe for tap over when I want to bring the gloves. Because the gloves the guy had to use. Bring the black gloves and put on whatever you have to put on it and push it and start it for me. Yeah, because for me, my brother, better to be safe than sorry, my friend. Yeah, so I go on again. I'll just keep on looking at the wonderful discussion you all are having. Go ahead and do it, Carlyle. Go ahead and do it, my brother and friend. And all you to my body, go ahead and get it done. If you haven't got it done, go and get it done, my brother. Better to be safe than sorry. I go on.
All right, thanks, Biggs. I think we got Francois on the line. Francois, you there?
Yeah, I'm here. Good afternoon, everyone.
Good afternoon.
But just to throw that is a question as I was listening there. Is this so, Dr. Leacock? Is it safe to say it's a guarantee that as an adult male, once you achieve a certain age, this prostate, you're bound to have prostate problems? Is it safe to say that?
Dr. Leacock?
Hello, you listen to me?
Yeah.
Somebody knocked me off, so I didn't hear you. I was out. I had to log out and log back in. So,
Yeah.
ask
No, I was
him
just
again.
asking, right? Is it would be safe to say that once you achieve as a male, as an adult male, and you reach a particular age, that you are going to have prostate problems? No ifs, buts, or maybes. Is that safe to say?
No, it's not safe to say because some people pass through all life and never have a day's trouble. Yes,
Okay.
and although we say at age 40 you should go and check, it's not this is statistically speaking. There's no reason why at 35 you can have problems. Some of us inherit things, and we draw the short straw for some things in life, etc. and so forth. There is a statement which says that if you live long enough, if all of us live long enough, our prostate will probably go cancerous anyway.
But one thing I could say to that is that between me and my brothers, there's 5 brothers, right? And the percentage is so high that 3 of us already have the same thing. So only two left.
Oh. Yeah. But the other question
So
I was having, right?
Our percentage is very, very high in our family.
Okay. Yeah, I was saying that like with the internet and so on, we see that a lot of people. Someone was telling me the other day that a doctor was telling them that, with Google and all these things being so common now, everybody feel like they're experts and everything, right? But we encourage people to go and check at particular, when you reach a particular age. But with Google, I see, for example, because I might be kind of guilty of that sometimes. You read a lot, you research a lot, and you would see all these videos, all these little tutorials. They tell you what to look for, the signs, the symptoms, and so on. So people look at that and say, but I haven't seen any of those symptoms, any of those signs in myself, so I'm good. But would you still encourage that, in spite of all of that we should still get the checks done?
But Francois, I
would.
had no symptoms. That's what I said. I had 0 symptoms except the PSA jump. The PSA jump about 3 years. It jumped unusual. But outside of that, and then because of my age, 65, I'm 65. So the at 265, that ain't bad. That is, as my urologist say, that is normal. But the drum make you know that something is going on. So if you don't go and get checked annually, if I just suppose I used to be one of them people who just don't like to go to the doctor periodly, and where you think would have happened? I wouldn't know what's going on with the every year, the numbers every year. So I had nothing to compare it to. So when I get 265, I say, oh man, my age, that is good. But in the meantime, so that is why you gotta go get checked annually.
All right. I
Yep. Kegel exercises, Dr. Leacock. Is that like a preventative method? Is that a way of um, mitigating the progression of prostate cancer or prostatitis? Examinations, Kegel exercises.
Mm.
How can that help with?
So, so, so Kegels has something to do with your pelvic floor integrity.
Mhm.
And it's probably more important for women than men. Not that men don't need it. So one of the disadvantages of being female is that you have babies, and babies' head sit in your pelvis for 9 months, and during that time it pushes on the pelvic floor and it stretches the pelvic muscles, etc. And as you get older as a woman, when your estrogen levels fall, the elasticity in your pelvic floor goes. So you end up with problems like prolapse, that is the uterus coming down and coming through the vagina. But you also have problems with what you call incontinence. You can't keep your urine in, etc., and so forth. So the Kegels exercise will be for that, basically for that. And with men, it would be for the same thing. So that's why I asked Doug if he had a physiotherapist, because sometimes you could also end up after prostate surgery having what they call urinary incontinence.
That's another thing I want to ask. They call it
You drip.
stoppage of water here. Is
No,
that
that's the opposite. Incontinence means that you can't stop yourself from peeing, so
okay?
you keep wetting yourself, and that is where the Kegels will come in, because the Kegels will help you to strengthen the pelvic floor muscles, because the tube from your bladder where the prostate sit has to pass through that little opening in what we call the pelvic floor. So if we
Okay.
if we tighten the muscles around there, you can literally use the muscles to squeeze off the tube leading from your bladder and help you to contain your urine.
All right, we got a call on the line. Good afternoon. You're live on Nice Radio.
Good afternoon.
Hi. Good
This is
afternoon.
the lady with the call about the radio. Anyhow, I get a radio to borrow because I just like to hear the program.
Mr.
And like,
Elvis said he bringing a radio for don't worry, don't worry.
yeah,
And
but
Princess,
you
what it
know,
cost me for the other day?
Mm.
I'm watching something here in a book I have here, right?
Mm.
It have diet for preventing each type of cancer. And when I hear Doc talking about the prostate, it say increase fruit, tomatoes, dry fruits, dates, raisins, legumes, soy, tofu, soy milk beverage, citrus, pectin, garlic, fructose, vitamin E, carotenoid, and lycopene. That is what he said, to increase, to keep with the prostate cancer.
Okay.
So I want to know if that alone could do the job. Dr. Leacock,
Yes,
that alone,
Princess.
that
I hear
alone
you
could do
telling
the
me.
job.
I hear you telling me off this week, but that's okay. No, the thing is, Princess,
Yeah.
there are lots of things what we call additive things and so forth. I think if you just go into that, one of the things we feel, yeah,
Uh-huh.
why Caribbean men and and American black men have this problem has to do something with slavery and our
Mm.
diet during slavery. And it's just last night I was discussing that, where in the days gone by, everything had to be salted
Mm-hmm.
and and stored, and so it could be the salt peat and the things that we use to preserve things and so forth. The other thing could be something genetic. There is something where there's a combination, multifactorial we call it, a combination of lots of things that sets us up. So I am not going to dismiss your diet, but I'll put it to you that if you just stick on a diet like that alone and say, well, you won't get prostate cancer, you're probably likely to get it if you have all the other factors factored in, such as your genetics and your family inheritance, etc., and so forth.
All right.
So I would
But
tell you don't do that, but that would be as an additive. Yes?
yeah.
Right? And there is evidence that if we cut out a lot of the fats in our diet, right, that we probably would have less of a chance of having that happen to us.
I think one of the things is that, for instance, like I don't eat, I don't eat, I stop eat meat more than 2/3 of my life.
Mm.
I stop eat meat, right? And especially red meat. I used to eat chicken and thing. I cut that out about 26, 27 years ago. Chicken and turkey. So I cut all meats out of my diet. I eat fish. And it got certain fish I would not eat because I don't like them. But the thing about it is, and I rather deal with fruits and vegetables. If you read some of the fruits and vegetables, you hear me, Carlyle?
Yeah, I'm hearing you. Go ahead. Yeah.
Okay. If you hear fruit, if you see fruits and vegetables, I eat a lot of that. Now, this is soursop and stuff like that. Got a
Say
lot of,
guava as well,
yeah, a lot of things. Now you have in St. Vincent and other places, you have now they say this is good for your prostate, stinging nettle, piss of bed, and they got a lot of different things that are good for prostate flushing, I guess, or treatment to lower your risk. But as Dr. Leacock said, and that is what Princess got to understand, if you are in that high risk category, like me, I'm in a high risk category. My brother, my other two brothers, I know they might be sweating this one because we have 5 brothers and 3 of them already have prostate.
Oh, wow.
What do you think is the chances of the other 2?
I see.
You see the height? You see the height of the chance? So they could drink all this thing in it and eat all the different things. If they don't go and get checked to make sure it is under control, then what good it is the eating stuff? Because as Dr. Leacock said, you fall into the category. So all these are things that some of our people must understand. And some people say, well, I drinking stinging nettle and I doing this and I doing that and I doing the other. So I ain't gonna get it. No. It might help to minimize it, but it ain't mean you ain't gonna get it. So you gotta go and get checked. That's the bottom line. You got to get checked.
And Big just calling and he said, I don't like him talk about the poisonous thing in the arm. I don't have any objection to people expressing themselves and so forth. That's his opinion. He's entitled to it. So I'm not going to have an argument or fight with him. But there's also cancer vaccines coming along, yeah? It's just to tell you that. And the cancer vaccine technology has been in for over 20 years. And in fact, when COVID came along, it's because they had all that background knowledge that they were able to divert quickly and develop a vaccine that
Dr.
saved
Leacock,
people
stick up in
from
there. I
COVID,
got another call on the line. WhatsApp caller. Good afternoon.
Yeah, good afternoon, sir. How you doing?
All right. Okay.
Yeah, I got a question for the doctor because I normally see the urologist every year. But this year when I went, he asked me if I have any problems, any signs of anything. I told him no, I just want to do a check. And then he asked me if I want to do it to the anal or to the testicles, which was surprising. I never know that it could have been done that way. So I tell him do the testicle because I normally do it anally sometime, and I do the PSA also. So that's the thing I want to ask about. The other method that you can do that.
Through the testicles, meaning that is an operation, is something that they have to cut. They have to.
No. When I went, he tested me. Say if I want to go to my, with his finger to test me, or he just do it by my testicles.
All right.
And that's what he did.
That one
He
has
feel
been
my
made. I don't know how you could examine the prostate through your testicles. So that's something I
yeah.
will
So
need. Huh?
that's why I'm asking, because I've never heard that before. So he asked me to drop my pants, and then he tests my testicles and stuff. So
Yeah, but that will tell you what the size your testicles are. That ain't nowhere near your prostate. Your testicles are external, your prostate is
right.
internal. So I don't know how that
But
is arrived at. I don't want to question anybody's method, but I've not heard of that and so forth. That is something that is foreign to me.
right, and that was a urologist that I went to. But my that said my PS score was 0.3, so it's very low.
Yeah. But you heard the
That,
discussion before that I had with Doug about the PSA being very low. I'm not telling you not to trust your PSA, but sometimes you can become too um self-assured that my PSA is low, that nothing is amiss, when there is in fact something amiss, which was, you know. So you look at trends
right,
and so forth, and if things worry you significantly, go and ask people and ask for check. There's nothing wrong with asking to be rechecked.
right, and that worked both ways, because my premier doctor, he told me the PSA test is good, but also at times you need the anal test.
Yes.
Yep.
And then on the other hand, there was a guy who told me he ended up with prostate cancer, and he used to do the anal yearly, and then he went and did the PSA, and that's how they found out he had it, because his PSA was so high.
Okay.
So what happened? He never used to do a PSA when he do the anal?
No.
No. I do. My doctor do both
But
of them the same time.
yeah,
Every
you have to
year.
have both. You can't do one and leave the other
Every
one
year.
out.
He do the two of them the same time. Same time.
Yeah. Normally I would do one or the other, either the blood or that,
Nah,
and
nah,
I'll
nah, nah.
alternate 1 year this way, 1 year the other.
No. My doctor does do the two of them. Well, sometimes it depends on the insurance. You got the insurance, don't pay. Because sometimes insurance say they only, like if you're doing a colonoscopy, I just making a thing. If you're doing a colonoscopy, they say a colonoscopy every 5 years, the insurance go pay. But if you got a doctor who seeing something in your colon and he do it every 3 years, he got to put in the reason why he got to pay, because a colonoscopy, those things are a little pricey. So sometimes the insurance ain't got no assurance.
All right.
Yeah. Well, I it's the doctor who asks me normally what I want to do, and I'll tell him.
Okay.
In my case, I don't know for other people. In my case, he will ask me which one I want, and I'll say this one or that one.
All right.
Doctor don't ask you what you want to do. He just tell you what you're going to do.
All right. Somebody on WhatsApp says my PSA was 9 a few months ago.
Oh,
Later, it was 10. Ask the doctor if that is bad. Thank you.
bad.
Yes, it's high.
Okay.
Again, we go back to this concept of saying, so the PSA is sensitive, but it's not very specific,
Mm-hmm.
right? Sensitive means that if there is any tissue wrong that produces, like the prostate that produces that, it will pick it up. So there are other things that will make your PSA go up, right? But a high PSA doesn't necessarily say that definitely you do have it, right? The other thing that they use the PSA is to monitor if you have the cancer and you have treatment, like say chemotherapy, etc., and so forth, and your PSA starts going up, then they know you have recurrence, because they've treated it, it came down, and now it start climbing again. So they stay, well, you probably have recurrence and need further treatment.
Because doc, my brother now, when he go and check his PSA, it's 0.
Yeah, that's because he has no prostate.
Yeah, well, PSA is 0. So I expect to see mine on 0 when I go back next year.
Yeah. Right. So the frightening thing will be if you go and then it start climbing up, then they'll have to start to look for a reason. Why do you have a high PSA?
Yeah, they gotta look other places in my body.
Yes.
Yeah.
All right. Somebody say good topic as usual. All right. 4565967. France, are you there? Because I'm getting calls backing up on the WhatsApp and you holding up one line.
All right. Well, yeah. Well, I'll think, and I'll call back in a bit.
All right. Okay. Cool. Thanks.
Yeah.
Nice radio. Good afternoon. You're live.
Hi. Good afternoon.
Hi. Good afternoon.
I want to Dr. Leacock. If you can already sort of what is the cause of really restless sleep at night.
I'm not hearing you properly.
Yes.
Yeah.
About the sleeping problem at night.
Sleeping problem at night?
Years I'm going through this problem. No sleep. Many years, no sleep. I go to the doctor and there's constant urine and so on. And like you're restless at night, you know, and I don't know what's the cause of this, and I say could be stress, but I'm really getting, you know, sometimes you get so frustrated about what you're experiencing. Because, you know, when you're getting asleep and, you know, it's so troubling. You know,
how old are you?
So many. Yes. Dr. You can explain a little about that, please.
No, how old? He's asking how old are you? Are you hearing Dr. Leacock good? Yes.
I'm 70.
You're 70. You ever had a prostate? You ever had your prostate checked?
Yes, I take prostate check, you know, and the last time I take the other one was, doctor told me it was small, very small, you know, and I take blood tests, I take the other tests, but I decided to go and take a full checkup again. So if you can explain a little about...
Is he a day sleeper then?
You sleep in the day? Do you sleep in the day?
I don't get sleep in the day. Sometimes I can sleep, and when I go to lie down, there is no sleep coming to you.
Okay.
I'm taking some medication, help me out in the night, and it's just useless.
Okay.
What's the medication called?
Huh?
What medication are you taking?
Well, I just can't... I take so many different kinds of different doctor gave me, you know, but I can't just sleep because my is limit. I don't have much to you know, to keep in touch with the doctor. Yeah. If you can just
and you
explain.
exercise?
Yeah, I do some normal exercise. You know, swimming. I do a lot of that sometimes. Yeah. But if you can just, you know, little for me, please.
That might just be your physiology that you don't sleep, you don't need a lot of sleep. But there's a drug called melatonin, which I think is coming out, has been on the market now. You could probably try that and see if that makes a difference.
Okay then.
Yep.
All right.
One of the things when I
will listen to you because I don't have much credit. You're gonna run out now. I will listen to you.
All right, thank you.
When anytime I used to, since I retire and I find myself, if I don't do too much activities, I find myself still up at 1, 2 o'clock, and then I still get up back at 5:30 or whatever, 6 o'clock. So I don't get a lot of sleep. So when I want to, that's why I run a lot. That's why I exercise a lot. So I tire myself to sleep if I have to. That's what I do.
But you don't need that much sleep as you get older though, because I'm like you. I go to bed later and I'm up at 6, and there's no reason for me to be up at 6.
And I'm not really tired or nothing like that, you know. It's
exactly.
Not that I'm tired or nothing like that, but it's just that I want to get extra sleep. So one of my things is to swim in the evening in the sea. If I get to the sea in the evening and I'm tired, I swim. If I ain't too tired, I wet my foot in the sea and I go back in my car. But if I'm tired, then I'll take a nice swim.
Yeah.
And some people don't know why I go to the beach and I wet my foot and I go back home. And then another time I just take a nice swim. You know, but it's different reasons. I just want to throw that in the mix.
All right, we got Mikey in the mix. Mikey, good afternoon, you're live.
Good afternoon,
Hey,
Mr. Carlyle.
Good afternoon.
The doctor, Odd, and Doug. Very, very refreshing dialogue this morning. I remember asking that Doug, when he finished, that he come here and he talk and as a sense of awareness to our brothers out there who getting scared of doing getting proper medical care and checking up for the prostate. And I caller before Francois asked if there was any symptoms that Doug was feeling before he actually get the diagnosis from his doctor, and that doctor said that he didn't feel anything. But that is why proper health care is necessary, and you need to check your doctor regularly to forget to know how your body is functioning. Don't wait until you start to feel the pain. Otherwise, you'll be playing catch up. And it's such a nice program this morning. And I want to say, I just called to say, I'm glad that Doug coming is in the studio, and Dr. Leacock, I think you're doing a very good job. I started to look at you now as nice radio residency doctor. Because no, serious thing. I
Put some
think
money
you are
in
really doing a
Dr.
very good job
Galton.
to the Vincentian people and all the listening audience. All you do your thing with giving us the social issues, and Carlyle for facilitating this kind of dialogue. Doug and your other brother MacArthur, very good program, man. And we cannot wait. My main call this morning, I think I did write it one time in the blog that we must get Doug to speak to Dr. Leacock as a sense of awareness for our people. And I want to say, very good job this morning. Very good job.
Thank you.
Have a good day,
Yes.
my brothers. Huh?
I say
What you
yes,
say, Doug?
I say yes, you said that. You said that, and I promise I will do it. And
Yes.
and here I am, because I see too much of our brothers go down
Mhm.
unnecessarily. I think a lot of
Yes,
it could
man.
be prevented. So I hope what we're doing here today will make some of them be more aware that
Yes. That sense of
yeah,
awareness, man. You got
yeah,
to get that. You got to instill that in my people. And as I show you, as Dr. Leacock said, that I used to have that notion that I don't want that, but I have a Haitian lady doctor, and my wife drive me to go and do the test. I told you when I did it, I came home. I was angry. I wanted to beat her up. You know what I mean? Because I never really got those kind of tests done before. But it's so funny now that the test that she usually do is that she check my blood and she do whatever she got to do and so on. But you got to do it, man. You got to go to the hospital, whatever medical facilities that you have, and then you got to take care of yourself. Nothing is like a proper healthcare system. And that is why I will always fight to see those things come in St. Vincent and the Grenadines. And good job, Dr. Leacock, man. You're
But
doing a
Mikey,
very
it is
good service.
still
Huh?
very uncomfortable.
Hmm?
I say it is still, the digital exam is still very uncomfortable, no matter how much time you do it.
Man, yes. Come on, man. It's the way we grew up in the odd. You have
No,
to
this is no where I
understand.
grew up. This is no where I grew up. It's
It's
uncomfortable.
uncomfortable. Yeah.
Yeah, but no. When something is to save your life, sometimes as you
No,
say, we gotta bite the dust. We
no,
gotta
that's right.
we gotta
That's right.
bite the
It's agree
we
with that
gotta bite the
sentiment.
stone. And do what we gotta do.
Bite the bullet.
Oh, and one more thing I wanna drop into the conversation. And I read a lot about certain things, and they look at different demographics around the world and the people with certain disease that they think. And one of the people they say like prostate cancer is not prevalent in the environment is when people the Mediterranean people, and this is due to the Mediterranean diet where they
All
eat a lot
about
of
the there.
nuts and grains and those things. So I think sometimes we gotta encompass eating a lot of nuts and grains and all those things, and that's why you mentioned guava. Guava have a lot of seeds in it. I used to eat as a young man. I used to eat papaya seed. I eat the papa, I eat the seed. I don't care. I try to trade up. But those are the things.
Woo!
A diet of grains, a diet with grains is very, very, very good. And as I say, we talk about soursop, drinking soursop leaf tea, and we must remember we as Vincentian too. We move away from a lot of the things that our old people used to use. We don't drink bush tea anymore. We don't drink bush tea anymore. Everybody wanna eat the Ovaltine, the Milo, and the fried cocoa and all these things. We don't even want to eat chocolate, drink some chocolate tea where we grate the nutmeg and the cinnamon and the spice. We got to get back to the things that give our older folks, that Alwayn said, how his mom lived till she reached 80 something. We got to go
90,
back to the
90
diet.
something.
That's
90
Hmm?
something.
Okay. We better go back to
we
the.
have to
We better go back there
bless up my
because Alwayn,
Mac.
I know your mother used to drink a lot of those things. She drink a lot of
Yeah,
those bush tea
my
and
mother
all
also had a lot of her own local remedies, etc., which I
those
always
things.
promised
Hmm?
to
Eh,
copy and write down, and I never did it, and it's something that haunts me today. That I never
Man,
got to
when
sit with
last yes, you don't see
some
anybody
local
talk
remedies.
about I drink some body me I shadow Vinny, seed and the leaf and all those kind of things.
You
Those
th-
things used to be tea that we
you
used to drink in the morning.
you thinking about this?
Sometimes
You thinking about this song right here?
brothers, let me continue listen, man, because sometimes I don't like the dialogue, but sometimes I don't- the answer the time the audio the song just take to travel. Sometimes we get crossing and everything, but I listen, man, and very good program. Alwyn, you're doing a good job, and Doug, thanks for your bravery and for to making us aware. All right, brother,
All right.
I like it.
All right,
Thank you.
man.
Okay.
Thank you. All right. Somebody was on WhatsApp on hold. Good. Nice radio. Good afternoon.
It is me, the MAC.
Hey, MacArthur, how you doing? I thought you jumped ship on. I thought you jumped ship on
Yeah,
us,
I
man.
thought Mac
Yeah,
bought those
um,
last week.
I,
You
I
didn't
had to
celebrate
do
another
it.
month.
Like he's still celebrating.
It is me, the MAC.
Yeah, how's it going? How's it going?
Listen, man. I had to drop in. I'm in an area where I can't even access getting on the stream because the internet is spotty. But I just wanted to call in because I followed most of the program. And let me tell you something. It is no underestimation. It is no understatement when we say the services that are provided by Nice Radio, inclusive of this program, is a nation building. This is a nation building exercise. And I want to personally, as a member of this panel, to congratulate every single one of you guys and all of the participants who called in. And especially so of Doug, who was able to open up something that many people would consider to be a private medical matter on behalf of men in St. Vincent and the Grenadines, because we know that issues like prostate cancer predominates among men of African descent. And this is something that this was a public service that you guys, including and I would give him this name, the esteemed Dr. Leacock, provides for us on a daily basis, and we are nation builders. We are nation builders, and congratulations, guys. And I am inspired as of this moment to, as soon as possible, go and get my own prostate checked, right? And I'm pretty sure the benefits of this program are incalculable, immeasurable, because who knows how many lives, Vincentians and otherwise who are listening, would have been saved by this intervention, this timely intervention by Doug and Dr. Leacock and all of the other members of the panel. So congratulations, guys. Big up, man. And to the people of Layu strong always. Love, man. Have a great weekend.
I love.
I'm continuing listening more here. Okay.
Somebody on WhatsApp says, tell the man who can't sleep to go to YouTube and listen Psalm 91 and 93. Trust me, that works for me.
Good advice.
Next one says, I had an anal examination and the urologist says my prostate was soft. Ask Dr. Leacock how about that.
I'm gonna jump off, guys.
All right. Thanks, Mike.
Okay.
Thanks. Take care.
Okay.
Yeah.
And Carl, I beg your indulgence. I also have to leave now. I'm very, very sorry.
Wow.
Sorry about that. What was that, Odd?
I am begging your indulgence, sir. I have to leave now also. Thank you.
You're begging you. I need to beg my indulgence. Thanks for your participation, and always look forward. For you being on part of the panel. 456-5967-718-734-5615. Speak now or forever hold your peace. WhatsApp 4983802. And let me see any Facebook comments. No. Anybody looking at Facebook? Anything that you, any topics that you would like us to cover with regards to health? Let me see. We got another caller. Nice radio. Good afternoon. You're live.
Good afternoon.
Hey, good afternoon. How you doing?
I want to ask Doug if after the operation and everything cure, if the urine bag is going to be removed or he's going to continue with it for the rest of his life.
No. The urine bag is going to be removed in about another 7 or 10 days. Periodly. It won't be there. And then I will do my exercise, build back my muscles, and hopefully within, I would say, within another 2 months, 3 months, I'll be able to go back to normal. Because the thing about it, I think, is that you have to do the exercise to build the muscle, because the muscle is what actually holds the urine into your bladder.
So that's where the Kegels are coming in.
Right.
That you mentioned, because once the catheter comes out, so the catheter has two purposes. One is to allow free drainage, so that you don't have a build-up inside it, and then the sutures come apart where the surgery drawing the bladder back up to your penis to get the urine to flow, right? So the catheter is there to allow that to heal. So that need to be healed completely. So 7 to 10 days normally things would heal. When the catheter does come out, then is when you're going to find out whether or not you could retain urine or not. You may be able to do that, but other people end up with incontinence, which is the opposite to stoppage of water, Carlyle.
Okay.
Right? And then you have to go and get Kegels exercises and physiotherapy in order to sort that out. And that some people that may persist up to 9 months, 9-10 months.
All right.
Yeah.
Yeah, I remember. I was telling Doug this morning, and I also telling Dougie that after my operation, they had a problem where they put in the catheter wrong, and it had it was uncomfortable until finally one doctor listened to me and took the catheter out, and I started peeing normally again. But that created a problem for me, wherein that I couldn't hold my pee for like about 3-4 days after my operation. By the time I get up out of the bed to get to the bathroom, I would pee on myself, but thank God I got to manage to put that behind me. But I said peeing on yourself is not something that you necessarily want to admit. But I'm encouraged by Doug, and with the bag and everything, that he has to carry a bag and everything, and the purpose of this whole program this morning, we've been talking for over 2 hours here this morning, is for other people to learn from these experiences, to shy away from any myth that you might have, with regards to men's health, with regards to prostate cancer, prostatitis, or whatever, and let's live. Let's live. 6 minutes after 1 o'clock. 6 minutes after 1 o'clock. Is anybody else? Isn't nobody is holding? My mother always says eat papaya seeds. It's good for work. Yeah. All right.
Yeah, but the other thing to Carlyle is that we have to be very mindful. We have to be mindful about some of us black men. We have this thing about us that we don't want to talk, and I don't want nobody to know your business, and these kind of things that, to me, these are stupidity. Because if you could help your brothers in this particular case, if you could help your brothers to take that extra step forward in these situations, that they may save not only their lives. As I said before, and I will say it again, you know what it is to deal with all of these family members who have to take care of you when you refuse to take care of yourself in the beginning, and now you're going down. You can't do nothing for yourself. You know, it wears on your family. It wears on your children. It wears on your extended family, your wife and your extended family. It wears on them. And it don't necessarily shouldn't necessarily have to go down that way. It shouldn't. It shouldn't.
Okay. All right. We got another call on the line. Good afternoon, Nice Radio Live.
Good afternoon, Carlyle. Me again. I want to ask Dr. Leacock something. Dr. Leacock, I'm a diabetic with Princess. And I drink a lot of water through the day. A lot. Even when I go in the bath at night again, I have to drink certain amount. How much time I think I should get up and pass urine? How much time so I should get up?
So Princess, normally say you should get up 3 times a night. Most people get up just once a night. As you get older, 3 times is enough. More than 3 times is abnormal. But that depends on how much you drink. Because if you go and drink
I drink a lot of water.
A whole 10 o'clock before you go to bed, you'll probably get up more often than that. So 3 times is probably your max.
Yeah, but I'll get up a little more than that.
Yeah, so is your diabetes well controlled, and if that's the case?
Well, it ain't that high.
Ain't that high don't mean that it's controlled. So you have to answer the key question. Is it well controlled? Because if your sugar is well controlled, then you should fall within that category. Huh?
What they're telling you to eat, really, sometimes I think that you can't get to eat.
Like what?
Green, a lot of green and that kind of thing. You can't get that. No, you can't get provision in the market to buy.
I live in a cold country, and I have tomatoes growing in my kitchen, and I have just dig up some potatoes out of the back. So I say that to say that
I can't make that. I have a sick knee, and to sit in the back of the two scab where I supposed to plant thing, I cannot go up there, and I don't have nobody.
No, get some containers and put them around the place. That my tomatoes growing in my kitchen.
Right.
You know? Try a little bucket gardening. It works.
But when you get bucket,
easy thing to
but
get.
What happens? The urine itself, it's real pretty. I just use a plastic pail in the night just to look at the urine when the morning come, and
which
it's pretty. It don't have no sign and nothing in it.
So that's good. But the fact that you're passing out a lot. Yeah?
Yeah.
But the fact that you get up so often, you have to check on your blood sugar. So if your blood sugar is high, you're going to go more often than you think.
Okay then, all right.
You need to try to get it down less than I don't know what figures you're using. 7 is what we use here, but 7 by 18, 7 8 is 56.
I had to go around the clinic Monday, so I will get it checked
120, I think, is probably what we might use in St. Vincent. We might use different figures in St. Vincent. I was just trying to convert one figure to the next.
Okay.
Yeah.
Yeah.
So 7, I think, is what you need to get it down. But between 7 and 10 is dicey, but less than 7.
All right.
Right. And what are you taking?
Well, I don't. They just give me metformin. The metformin just sting me skin. And sometimes when you go around to the clinic, you can't get nothing. And if you don't have the money to buy it, you can't get it.
All right. So what about glyburide?
Huh?
Then there's glyburide, there's metformin.
Them things when I take the glyburide, I cannot go off.
It constipates you?
Yes.
All right.
So what I do, I just try to if I used to eat a little more, right, I eat less. I eat in.
No, but that wouldn't solve it.
Okay.
That wouldn't solve
But
it. So
they can't get the tablets wrong there, and when you go to when you go wrong, they can't, and you don't have the money to buy it at the same time. Cause my NIS said just pour something a month again, time I don't pay light bill and water bill. And I can't buy something. I can't even buy my tablet sometimes. For the amount, it's 15 years I do, and just pour something again.
And it's just you alone, no children or grandchildren to help?
Nobody here. I have a little great grand. Just they with me sometime when he already gone by his father. It's me alone they home here right now. But I rather do sometimes. But sometimes when he there, I just have to talk too much.
All right.
All right then.
All right. Thank you. Oh,
Right. That's some of the downsides of life. Yeah, when you have no money to buy some your medicine. Because sometimes if you go to the doctor and the doctor tell you in bad shape, you ain't necessarily mean you're bad shape health-wise, you mean you're bad shape financially. And in St. Vincent right now, a lot of people is in bad shape, but I think the doctor mean health-wise is financially because a lot of things you can't deal with. So these are things you gotta work on, you know?
All right. Okay, we have another call coming in. Nice radio. Good afternoon. You're live.
Yeah, it's me calling, Mark.
Yeah, Francois. How you doing? Yeah.
Right. But I just to sort of follow up on something that was said there, because that's what I was thinking all along, and that was the other point I was going to make about how sometimes some things are considered as cultural issues could sort of lead to a sort of miseducation and eventually like the detriment of our people. Because let's go back to the whole idea there of we talk about the exam, right? The traditional exams for the prostate, where they call it anal or rectal exam, right? And so a lot of people have this, well, men in particular. I don't know if it's some insecurity about sexuality or, just foolishness flat out. Because I was thinking, and well, I'd say he disappeared, he gone, right? But he came back to mind with the minibus situation. There's a sort of unwritten rule in our culture that if you're riding a minibus, then you can't have two male passengers in the front seat. Right? And in the case where you do have a female and a male, then the female has to be in the middle and all of that, right? For people who travel on minibuses often, they know what I'm talking about. You would see people rearrange the whole, the arrangement of the bus just to bring a female in front and so on. But again, we have these little things that we follow, and we listen to some of the music, and you have all of this thing being in it. And so we believe that there's certain things that as a man, you can't do this, you can't do that. Some of them don't make any sense at all. And I think that's like was leading to this sort of thing now, where we have this whole thing about, nobody's supposed to touch you this way, and you're not supposed to do that. You sometimes hear the youngsters, a guy would say something and say, boy, where you coming from? This next to man, and and you say, well, you're crazy. If you're in a classroom, in a public space, you will be next to female, sometimes next to male. But all these misunderstandings are just pure ignorance, leads to some of the problems that we have. So now a guy goes to the doctor and then he, you can't touch me here or there. I mean, it's just part of the thing. It's nothing. I'm not interested in you as a doctor, I'm a doctor, not interested in you as a person. I just want to examine you for your own benefit. And maybe sometimes if you could get, educational thing like we're doing here today, because this is big. And let me say one time, much respect to Doug and even to you, to Carlyle, because some of the things when as men, full grown men, mature men, you admit some of these things and you speak out. One is a certain level of bravery and confidence to be able to do that. And you do it now with a bigger mission in mind, not out of selfishness or just about me. This is about helping other people to come out. And that is much respected. And this is why I was saying since last week, the program is very much respected and appreciated more so than we even think. But again, we say the ignorance and some of the so-called cultural things that we have going on leads to some of these problems eventually in a lot of us. Sometimes to our detriment.
Boy,
And Francois,
that thing.
I think that is one of the things that I will continue to say because when you got these misconception of certain things and you refuse to do what is right.
Doug is stuck. Doug may be having some because he's frozen visually. He's frozen on the video, and seems like we lost the audio. Somebody's coming in on the phone. Nice radio. Good afternoon. You're
Hello,
live.
Carlyle.
Hey, how you doing?
Yeah, morning. With the last caller now, silly, he's right, because I remember one time I was in Jamaica, and I thinking about eating a Shirley biscuit, and
hello.
Minute remaining, and if you popsicle and things sucking in Jamaica, they laugh after you with that, and eating Shirley biscuit because of the name of this biscuit, Shirley.
Oh wow! I hear you. Yeah, I can tell you. Carl, I had a problem. I actually had a problem with the van one time. When CTVIEW Multimedia was just started, I used to have to take videos up to SVG TV and IKTV, and the one on heading to IKTV Prospect, the only van available, the only seat available was the middle seat in the van, and the conductor gave me hell, but I wouldn't move. It don't look good. It don't look good. It don't. He want to exchange a seat with somebody in the back, but I'm 6'4". I can't fit there. So it's something I can relate to. Carl, are you still there? What was this noise? Oh boy, your phone gone funky. Sorry. All right.
Just before you go, Carlyle.
Yeah.
I don't know which urologist would tell somebody that they could examine the prostate through their testicles. That is absolutely erroneous. I don't want to start any fights with people, etc. and so forth. But if you are a professional telling someone you could examine the prostate through the testicles, something is wrong.
I hear you.
There.
All right. That might technology that ain't reached to you yet. We have somebody.
Yeah, but
Somebody says, what is the option for someone being diagnosed with what Doug being through in SVG? What is the option for someone being diagnosed with what Doug has been through in SVG? Somebody tell me. I don't know.
That's a strange question. What do you mean? What's the option?
What are the medical options? What would that person have to go through?
Well, we have a urologist. I'm not here to thing. We do have a urologist in St. Vincent, so we are very grateful and a very skilled person. I think that's the person who managed my father at the time, and I think he managed him quite well.
I hope that's not the same one that missed the bullet in me, because I honor respect for he at all. That's a different story.
I'm not getting into personal things. I'm just telling you.
Yeah.
In the past, the urologist used to we didn't have a urologist. Used to have to be taken care of by the general surgeons. But now, when you have a person who is trained physically in that area, then I think we are at an advantage. The thing is, we don't have the advanced modalities such as robots and laser and all the other things that could be used. And so certainly we don't have radiotherapy available in St. Vincent, right? There is hormonal treatment that you can give for certain levels, and I suspect that will be available in St. Vincent, because New York is just a stone's throw away, especially now that we have an international airport and things could come in on a plane.
Hey, Carl.
All right. Hey, yes, Mac.
Yeah. I just wanted to jump back in because Francois said something that kind of touched the nerve about how we accede to these myths about male sexuality, and how it creates a hesitancy among many of us to go and get our prostate checked in the traditional way. And I blame that on the over patriarchy that we live in, the uber patriarchy that we live in, where we live in an extremely male dominated society.
Yeah,
In many ways,
you gotta keep getting the habit of breaking down these things.
yes,
Yes. You
yes.
know,
And
remember.
there is what Francois was saying. There's a sociological term for it's called heteronormativity, where the heterosexual part of our society's structure is normal, and anything that threatens that in any way, whether it be little or great, is perceived to be outside of the norm. And so what we are doing here, and I think I want to give Doug credit again, and Doc, and everybody, and everybody who participated, is that we are creating a permission structure. Last week I spoke about permission structure from the political perspective, but there is also personal permission structure where you may be hesitant. You may feel as if, okay, allowing somebody to, a doctor to, whatever, examine you that way is against your moral beliefs or your moral stance. But we are giving you a permission structure. We are affirming this permission structure that this would save your life. It is your responsibility to protect your body, right? You can't say, well, okay, I'm having a male with his finger examining you. It may be against God, but you have to also remember you were put in charge of God's temple, your body. You have a responsibility to protect it. So that is the permission structure we are talking about. This is your health. Nobody else is responsible for your health but yourself. And so I hope our men take this onus and go and get themselves checked. Just forget about this myth. Forget about this myth, because the advantages outweigh the disadvantages.
Somebody sent me a WhatsApp on my personal phone. Says, listen to the program. I also had a seed implantation done about 11 years ago. There's no issues and no complications. And my personal WhatsApp says, just got news that a 10-year-old girl got killed in Glen. And it said that is unconfirmed reports for now. All right. And
that just came in, Carl?
Yeah, that just came in. All right.
Wow.
And
wow. Anyway, I'm on the road, so let me continue listening off here. But I just wanted to jump in and keep up the great work, guys. Man, you guys have done a stellar job this morning, bringing this to the forefront. Doug, continue to get better, my friend.
Yeah, man.
All right,
buddy.
All right.
Okay, all right, guys. Have a great weekend.
Let me take the opportunity to wrap up first. I never done that, but I want to say that I've spent energies and efforts and research in bringing what we see and sharing on the screen here now. Dr. Leacock, I especially want to integrate this much with you with topics that we might be talking to, so listeners could get a visual as to what is transpiring. Plus, anything that we might want to discuss that is available on the internet as a video or whatever can be actually shared and discussed and and brought to fore with exactly what we're faced with here in St. Vincent and the Grenadines. Like I said, like this 10-year-old, the matter with the 10-year-old, could be able to research this on the internet and see any options as to whether it's it has merit or not. But like I said, it's something I would like to delve into, and explore even more, especially for advertisers, especially for the supporters of this program, financial supporters of this program. They're getting maximum exposure. Yes. All right. Doug Howard, if you can go first.
Yeah. Mm-hmm. Yeah. Well, I am always going to be grateful for what I am blessed with, and I think the blessing should come not from you, but I believe blessings should come through you. So as it comes through me, I will try to pass it on to people. Now, It's up to you. It's up to you to use what I bring to your advantage. Now, I remember the king of Swaziland said one time in the early 80s on a 60 Minutes program, he says, they used to call Swaziland the untouched part of Africa. He says, the white man come and he bring good idea. Good idea stay, white man go. The white man bring bad idea. Bad idea go, white man go. And the reason why I mention that is because I believe what transpired here today, it should, I know it would, change some, at least one life. And I think it will worth it, because too many of our black men, educated, tertiary education and all that kind of stuff, some of them just have common sense knowledge, some of them have none at all. But they all have in common this one thing about the anatomy and what they don't want and what they want. And that, I call that the ignorance will kill you. And I don't mean ignorant because you can't read and write. I mean ignorance because you have the knowledge and you refuse to use it. So our brothers, not only in St. Vincent and The Grenadines and us in the diaspora, but all of them around the world who continue to listen and follow this program and will see this program after, I hope they use the knowledge to go and check themselves, make sure that you do what you have to do. It will ease a lot of the pressures off of you in the future, especially when you start to get older and you get weaker. It will ease the pressure off of you then. It will ease the pressure off of your family. Because, this week, my wife she stayed home so she could make sure she looked after me. Okay? And it is good for she to spend 1 week with me than for me to live for years and she has to give everything up just to stay with me. It's too much pressure. It's too much pressure on that human being. And some of the human beings that will encounter these problems. So, as I say about the ignorance, put aside your ignorance and do what is right for you and your family. If you don't have a family, then you could do whatever you like. You could go in a nursing home and lay down and let them deal with you. They go let you there to get bed sores and all kind of stuff, and it will be your fault. You have to do what is right. And your health is the best wealth you will ever have as long as you breathe in the breath of life. Your health will be your best wealth. Have a good day, everybody.
All right. Thank you. Dr. Leacock?
Yeah, well, I want to say thanks to Doug for allowing me to ask him these questions. And as he said, if you would have saved one life, I think it would be well worth it. I just want to go back quickly to what I started out with this afternoon. I know we focus a lot on the prostate. It's about young girls starting the menstrual cycle and not having a conversation with the moms or dads about what happens to me next. The fact that they could become pregnant and that not to be satisfied, whether or not we provide sanitary provisions within schools. Headmistresses and headmasters should be taking care of that and have a female confident teacher that these girls could go to when these things start happening so that they could speak to. And girls who are having cyclical pain, not seeing the period who may have what we call imperforate vaginas where the blood isn't coming through, and that could have consequences for them late in their life, etc. and so forth. I want to thank you for allowing me this medium to try and spread news and so that we don't die of ignorance. Lastly but not least, my friend who passed away a couple of weeks ago, I believe has been interred today. I tell Sapix Mayors, and I just want to offer my condolences again to his surviving brothers and sisters, Patsy, Beth, um, Julie, what's it called? Winnie, sorry, um, and the two others, Toots, I know, and the other one they call Fopang. I really don't know the names.